The resident doctors are back to work after 2 months of a nationwide industrial action over several issues. Now, successive negotiations and a judgment of the National Industrial Court had failed to resolve the impasse between them and the federal government. However, thank goodness, other forms of intervention and a simple majority vote by the doctors were able to rally them back to duty. The doctors' return to work is our focus on this episode of Special Report. Thanks for joining us. I'm Jeffrey Uzongo. Resident doctors, no doubt, are inevitable in medical facilities across the country. They are medical school graduates and doctors in training who are taking part in a graduate medical education program. They are mostly the first you meet at medical facilities. They work at hospitals and doctors' offices to continue their education and training in a specialized field of medicine. The residency duty may be for a period of 3 to 7 years. Some of the services they offer includes diagnostics, managing and treating health conditions. They work strictly in intensive care units, emergency departments, operating rooms, and general patient wards. Their services most times are supervised by senior doctors in the medical facility. They start with more supervision and less complicated tasks. Their responsibility increases as they gain experience. The resident doctors have long complained about inadequate facilities at their hospitals. Other demands include life insurance coverage, a pay rise, and payment of unsettled wages.
As we speak, what I get and other health workers is 5,000 as hazard allowance, considering the enormous hazard we are exposed to. This, we believe that even federal government is playing politics with it, with the issue of the improved hazard allowance, which is not proper.
In April this year, the National Association of Resident Doctors called for a strike to drive home their demands. They, however, called off the industrial action after 10 days. This no doubt paralyzed activities at health facilities across the country.
The NEC noted grievous concerns, the circular from the head of service of the Federation, removing the House officers from the scheme of service and the consequential implementation by the Lagos State government. They also observed that some House officers are still being owed for 3 to 6 months' salaries. The NEC lamented the acute manpower shortage in most teaching hospitals and the attendant burnout effects on our members. The NEC unanimously resolved by vote to resume the total and indefinite strike action from 8 a.m. Monday, 2nd of August 2021. The NEC in particular demand the immediate withdrawal of the circular, removing House officers from the scheme of service.
And in another turn of event, on the 2nd of August, the national body, through its president, called for another strike to drive home their demands. Days into the strike action, more Nigerian doctors make attempt to leave the country. They seek for job opportunities abroad in the face of complaints about brain drain in the health sector.
The people in charge, the members of the cabinet, the labor minister, the health ministers, both of them are doctors, they are medical doctors. I'm sure NARD has represented me, all my grievances to them, and I'm sure they have more experience than I am. They are very much aware of how poor the health system is being run in the country. No insurance for doctors, no insurance for other health workers, and the risk the doctors and other health workers are exposed to what's more than the allowances given to them. I'm sure if they can profound a way or solution to the hazards being exposed by the doctors and the other healthcare workers, I'm sure it will go a long way. Apart from the remuneration, the poor remuneration, I mean.
At least over 200 doctors took part in an interview process in Abuja for those willing to work in Saudi Arabia. These doctors who are currently being interviewed by the Saudi Arabian hiring agents say they feel frustrated working in Nigeria. The applicants say their decision to go abroad is because the work environment in Nigeria is not conducive. 63 days after the strike action, members of the National Association of Resident Doctors suspend its nationwide strike. According to the president of the association, Dr. Godiya Ishaya, he explains that the strike should be put on hold for 6 weeks to give room for some level of reconciliation.
After critical appraisal of the performance of both federal and state government on all the issues that led to the ongoing strike as stated above, progress made in implementing previous agreement reached with the federal government, the intervention of His Excellency, the President of the Federal Republic of Nigeria, the Vice President, the Honorable Minister for Labor and Employment, Honorable Minister for Health and Honorable Minister for State Health, Director of Hospital Services, Registrar, Medical and Dental Council of Nigeria, Chairman, House Committee on Healthcare Services and his deputy, the Nigerian Medical Association President, well-meaning Nigerians and other government officials show of goodwill to return to negotiating table. NEC resolved by vote of a simple majority to suspend the total and indefinite strike action embarked upon on 2nd August 2021. Therefore, our members will resume full work on Wednesday, 6 October 2021 by 8 a.m.
The association asked the NOC to report back to the National Executive Council of the NMA periodically on the progress being made on implementing the Memorandum of Understanding.
The NEC urged the federal government to reciprocate the good faith and trust shown by the association by ensuring the following: continuous processing and payment of the ongoing 2021 and 2020 Medical Residency Training Fund, while ensuring that provision for 2022 is adequately captured in the 2022 budget. Commencement of the process of withdrawing the court case against National Association of Resident Doctors as agreed and as it contained in the Memorandum of Understanding signed with the Nigerian Medical Association. Commencement of the process of payment of the salary arrears of our members that were just migrated to the integrated personnel payroll information system from the GIFMIS platform. The NEC urged state government to urgently pay arrears of salaries and allowances owed to our members in their various state tertiary health institutions as observed above. The NEC urged the state government to ensure domestication of the Medical Residency Training Act in their state tertiary health institution as done in Delta State and Benue State. The NEC will convene after 6 weeks to reappraise progress made on the implementation of the agreement so far reached.
3 days after the announcement, the resident doctors returned to work. In Abeokuta, the Ogun State capital in Nigeria's southwest region, activities are gradually picking up at the Federal Medical Center Diaba, Abeokuta. As resident doctors are back at their duty post after a prolonged industrial action which brought services almost aground. At the federal government facility in the state capital, doctors attend to patients at different wards within the hospital. The Chief Medical Director, Professor Adewale Musa Olomu, seeks a better option to industrial action, asking the federal government and the doctors to amicably resolve the impasse in the interest of the general public.
The expectation is that definitely the patients will continue to receive the services. It will also boost the economy of the hospital, and we can continue to move. A wealthy nation, a healthy nation is a wealthy nation. So definitely it is. And we hope that all they have demanded for, the government will do it. And the last time, about a week ago, when we were at a retreat with the federal, the ministers of health, I think we have highlighted quite a lot of things and measures that we can take to prevent this type of long strikes in future, which I think the government will be ready to execute. And I think next time they should be very, very considerate. Yes, the patient that suffered, and it's not good for anybody. I think once they go on strike, a day or two, that should be enough sign to the government, and the government should listen to them. They should come back on time and they start their work. But even they don't need to go on strike. Once they continue to press, and the government too have been a very good government, I think they will listen to them and do what is needful, so that we will not unnecessarily suffer our patients unduly.
Members of the Nigerian Association of Resident Doctors have fully resumed at their duty posts in Zamfara State. They assured residents of the state of full health delivery services. Many patients were seen waiting to see doctors to attend to them. Jibril Abubakar, who had been visiting the hospital for the last 1 week, says he's happy to see doctors back to their various offices. He, however, called on the federal government to listen to the demands of the doctors in order to avoid future industrial action.
Today, seeing them on working is a joy to me, not to me only, to all the patients that came here. When I came here this morning, I met a lot of people here. But with the presence of resident doctors, they have attended, most of them have left to their homes. So it's a joy to all of us. I'm appealing to the federal government that they should listen to them. They should attend to what they need. Because it's not a small problem that resident doctors are on strike. For the first month, people have been having a lot of serious issues here in the hospitals. No doctors, there are a lot of patients. So I'm appealing to the federal government that they should listen to them and attend to their needs, so that this thing will not happen again.
Doctors are also delighted to return to their duty post, though they are met with workload at the Federal Medical Center in Gusau.
I can assure you that after the NARD, the headquarters called on all the doctors around to come back to work fully. I can assure you that in our center, we have 100% attendance. We complied with the rule of the National Association of Resident Doctors. And as you can see, we are fully working. Work has commenced in full earnest, and we made a very much workload, and the doctors are taking to their responsibilities, as you are seeing. And you can see right now we are in the family medicine department, and the workload is much. That is why you are seeing us up to this extent seeing patients. So we are glad that the NARD headquarters directed us to come back. It has been negotiated, and that is why you are seeing us here. And I can assure you that because of the directives of NARD, we are all here fully working. As you can see, the workload is much. We are seeing much patients, and you can see them as outpatients still around. And we assure you that we continue to do so, and the strike is called up, and work has commenced in full earnest.
You know, as usual, after 6 weeks, the NEC will come back and we will sit down, and we are going to review the level of implementation of the memorandum of action. If we are satisfied, fine and good, we will be happy and everybody will be happy. But if we are not satisfied, definitely we are going to take some stand, which I cannot tell you because it has to be for if the majority decide what to do, then that is what we are going to do. But for now, we are going to look, we are going to monitor and see the level of commitment from government before the next coming 6 weeks.
The chairman of the Nigerian Medical Association Zamfara State Chapter, Dr. Menna Bature, says the NMA decided to intervene in the impasse between the resident doctors and the federal government because of the hardship the strike puts on patients, especially at this period of COVID-19.
The part of what we have gotten at the level of NMA is a commitment from the federal government to be able to fulfill part of their own part of the bargain. And so as a result of that, some improvements were made regarding the commitment from the federal government. And based on that, the NMA also looking at the commitment from the government, and of course hand in hand with the consequences of the strike on the general public, now prevail on the Nigeria Association of Resident Doctors to consider suspending the strike. And as you can see at their National Executive Council meeting.
In the northwestern city of Kaduna, normal medical activities have resumed in the various federal government-owned hospitals following the suspension of the 63 days nationwide strike. Human activities have returned to the National Eye Center, Ahmadu Bello University Teaching Hospital Zaria, and the Federal Neuropsychiatric Hospital in Banawa. During the strike action, activities across the government-owned facilities were paralyzed. In Kaduna State, this action forced many patients with major health problems to move to private clinics, though with an additional cost, while those with minor cases were hurriedly discharged. At the outpatient department of the National Eye Center, some patients were seen waiting to be attended to by the doctors.
The strike was suspended, actually, not called off. And we gave some chance or some period for the government to attend to this whole issue. So we are on a lookout. We want to see what government will do. We believe after the intervention of Mr. President, some positive things will come out of it. So we don't want to just, because as it is, a lot of Nigerians are suffering based on this strike. And we can't keep this spirit of not putting Nigeria first. We don't want to be looked at as such people. So we decided to call off on that basis. Because if we say we want to wait for government to fulfill all we needed, it will take time. Government should be sincere. They should make sure whatever agreement they want to sign, they should be ready to fulfill those things. Because this harmony in health sector is actually has a very devastating effect. It has a very devastating effect. So to avoid this kind of thing, whatever agreement they want to go into, they should make sure they solve or stick to whatever agreement. They should fulfill their part as government. That way there will be harmony in the sector and won't be having recurrent issues like this.
For the excited patients who lament that the strike actually brought untold hardship on them, they appeal to both the doctors and government to find a common ground to resolve their differences.
In fact, we are happy now that the striking doctors are fully resumed. The only thing now on the part of government is to appeal to them and the government as well. Government should always try to keep their promise. Whenever they make a promise, let them try and keep the promise. And then on the part of the striking doctors, we want them to exercise a little more patience. Nigeria is a big country, and government have a lot of responsibilities. So let them exercise more patience, sympathize with the government, sympathize with the people, and sympathize with everybody. Once they do that, things will work well. Look at what is happening. A lot of people so many people, people are dying because of this striking. It's not the best for anybody. So honestly, it affects the people adversely. So we don't pray this thing will happen again.
In Lagos State, Nigeria's southwest region, there was not much difference in the outlook of things to what was obtainable during the strike across the healthcare facilities. A busy day for the returning resident doctors like Salmon Oladapo, who could only spare a few minutes from his schedule.
This morning, I have attended to so many patients, emergencies. So people have started coming to hospital as early as 4 a.m. this morning. So we are back. And also, we have to thank God Almighty for giving us our opportunity. And of course, the government at federal and state level. We also have to appreciate the stakeholders that have really come into this issue and try to make sure that the demands, they are mediate between the government and the resident doctor. So as far as Lagos State is concerned, we are going to, I'm going to appreciate Mr. Governor for coming out when we needed him most. He promised us that all our demands are going to be attended to.
The Chief Medical Director of LASUS explains that the resumption has seen a positive turnout.
I'm happy to report that as we speak, all the resident doctors are back on their beats. However, patient flow rate is still a bit slow because it takes time for that information to get across to the community and patients start coming. But we believe that by Friday, we would have gone back to our normal flow of activities in this hospital.
Activities at health facilities in the southeast region are gradually picking up soon after the call-off of a 2-month-old strike. A visit to the Federal Medical Center Omar here reveals a busy atmosphere as most outpatients were delighted that the strike has been suspended.
See, we are fully back to work, and our tradition has always been to attend to every patient that comes to the hospital. So that is still going to remain the situation. So every patient that comes to the hospital and requires attention will be given attention. You should also understand that our work is not like office work, where you have your closing time and then you close and you go your way. If a patient needs attention, you don't say I have closed. You have to do what you're supposed to do. And that is also why we stay back on call. So every patient will be attended.
Patients trooping en masse at the Federal Medical Center Katsina after the resumption of resident doctors. The doctors who had resumed at their duty posts moved around wards to attend to the patients.
For now, patients are trooping in en masse. In fact, yesterday alone, we admitted, in fact, the entire emergency unit is filled up just between yesterday and today. So we are back. The hospital is fully functional.
At the Jos University Teaching Hospital on the Plateau, resident doctors resumed with enthusiasm as they assist the consultants in attending to patients who had flocked to the hospital.
We expect an upsurge of patients because full work has resumed, and those that were not able to be attended to during this time, things like booked surgeries, elective surgeries, all of them will come back. What we have done as a hospital is we've gotten all the consumables ready so that we will not be taken unawares. But as it is, it's going to be a slow but progressive increase in the number of patients, and we will cope as far as that is concerned.
No doubt, resident doctors make the bulk of medical staff saddled with the responsibility of treating patients. Their 2 months absence from healthcare institutions brought some setbacks to the healthcare services left in the hands of the consultants.
You know, residency is postgraduate medical training in medical practice, in clinical practice. So when members are on strike, the residency training is disrupted, and then the fact that people are also dying without having access to health institutions is the reason why I believe the new leadership of the national leadership, you remember that we had our AGM a fortnight ago, and we had our national leadership under the leadership of Dr. Dere Godia Ishaya, decided that there is need to change strategy and call off this strike.
Everyone's expectation now is that what happened would never repeat again, hopefully, if all parties stick to the terms of agreement.
We hope the dark days are behind us. Our expectation is that all parties will honor their terms of agreement so the doctors can uphold their Hippocratic oath and continue to save lives. That's it on this episode of the program. Of course, thank you for your time and your usual company. I'm Jeffrey Uzongo.